Time now for our daily rising coronavirus crisis update. We'll start with where the numbers are here and around the world. So you can see we've got, remember, this is over the weekend, so this is since Thursday. We now have more than 2 million cases here in the U.S. That's an addition of 76,000 since Thursday. 115,472 deaths. That's an addition of more than 2,300 since Thursday. Around the world, we've got 7.9 million cases. That's 600,000 more added since Thursday. Still a lot of places around the world that are seeing spikes and increases. Deaths have reached 433,607. That is 16,667 since Thursday. And look, Saagar, it's really varied across the country. Some places have really gotten under control. Some places are seeing some surges and spikes post Memorial Day. We don't know what the fallout from the protests will be, but Dr. Fauci did sound a hopeful note that we may escape a second surge. So that was very encouraging to hear.
Yeah, it really is. But at the same time, I mean, what we've seen and we've covered here now is really a complete media hypocrisy on this story, like we see with the Trump campaign and their announcement, and we'll start holding rallies again. All of a sudden, people start caring a lot more about coronavirus, and kind of in the perfect side by side, we saw NBC News tweet about a large, I think, Black Lives Matter demonstration that happened in Brooklyn over the weekend. Hours later, saying experts fear that coronavirus may be a problem whenever the Trump campaign holds a rally in Tulsa, Oklahoma later on June 20th. So I think the hypocrisy, I mean, I've covered this here before, which is that as you and I, as citizens, are capable of making up our minds on if the experts say this is a problem, but you say this cause is worth something more to me than risking that, and I want to go out there and protest in the street, then that's fine. But the experts are not supposed to change their opinion, and the media is not supposed to selectively report when they're concerned and when they're not. Science does not care whether your rally is for something that you think is a just cause or not. And it's just the hypocrisy on this story has really just been absolutely stunning.
Yeah, I think that's right. We should know what the information is. You should know what the attendant risk is, and then you should conduct yourself accordingly. If it is a cause, and it's not up to the public health experts to tell you which cause is worth the risk and which is not worth the risk. It's up to them to tell you, here's the risk, and then you make those decisions in your life. I mean, we saw a lot of, especially around Memorial Day, but even before that, we saw a lot of like moral panic and outrage over pool parties and people going to the beach and things like that. You know, that seems to have died down. But right coming on the heels of this protest movement, you see a lot of hand-wringing and media coverage about, oh my goodness, is it irresponsible to have a rally at this point? Again, look, it's a risk. There's no doubt about that. We should all be clear-eyed about that. But it is not your job to tell us which risk is and isn't worth taking. You should just lay out what the facts are and people can decide for themselves. I think that's the best approach, clearly. Yes. You and I tried to be very fair, even though, I don't think either one of us really supported the mission of the anti-lockdown protesters, but we tried to be very fair to them that this was clearly something they saw as important enough to go out in the streets and make their demands. Same with the Black Lives Matter protesters. I supported, I was out there with them, right? I think that, if that is your cause and you believe in it, like get out there and protest. That's fine. Wear your mask, be as safe as you possibly can, but don't pretend that there's not a risk.
Yes, exactly. Which is that all anybody wants is consistency, because when they don't have it, then they feel gaslit. And by the way, they'll never listen to you again. If there's a second wave, which as Dr. Fauci says may not happen, but if there is, I don't think people are going to be listening to any of these people for quite some time. But
yeah, that's the unfortunate part.
Yeah, exactly. All right, we're going to be back tomorrow for our latest crisis update. Please also like and share this video so they can help find it, and we'll see you guys tomorrow.